This is Late Night Health, your radio and video internet program that cares about the most important part of your life. During the next 20 minutes or so, we're going to talk about something that touches most of us. Well, we'll find out what I mean by that. Hi, I'm Mark Alyn. Our guest is, as always, Dr. Greg Celaya, and he is a doctor of chiropractic, has a master's degree in nutrition and numerous certifications in nutrition counseling. Dr. Celaya, welcome to Late Night Health.
Hey, Mark, good to talk to you today.
I mentioned touch, and I was being a little facetious here. We're going to talk about breast implants, and I guess how they impact women. Are they good or are they bad?
You know, that's an interesting question because, in the U.S., and these are kind of rough numbers because, are they really a reportable surgery? But in the U.S., it's about 4.1% of women have them. And theoretically, worldwide, there's about 10 million women that have had them in the last decade. And so, we've seen them around for quite some time. In fact, here, I'm going to do a screen share here, and this is kind of new for us.
All right. There I am.
Okay, there you go. I don't know. Can you see that?
Yeah.
All right. So, you're looking at the breast augmentation rates of cosmetic procedures on women in the U.S. And you can see quite a bit of a raise in time. Then we started to plateau and come down here, and it's you're bumping all over the place.
Right.
And it's a tough dilemma to determine why this all happened. But at one point, it was the craze. But now, we're starting to see more women with symptomology coming up from surgeries. So let's see if we can stop this screen share here.
Good.
All right, we good? Are we clear again?
Yeah, we are clear again.
Excellent, excellent.
What kind of symptoms happen when a woman has breast augmentation?
There's so many different things, and we're going to talk a little bit about research as well, but a lot of women call it breast implant illness. And you can have everything from rashes, body odor, irregular heartbeat, anxiety, neurological issues, hair loss, endocrine disruption. And one of the big ones we're going to talk about is autoimmunity and even cancer.
Oh my. Now, a number of years ago, and this is more than 10 years ago, there were leaky breast implants, and the material that was inside the bag was leaking because the plastic around it broke, and that material got into the body of the woman, and that made a significant difference. I mean, it was very harmful.
Yeah, well, way back when, there was a silicone bag filled with silicone. And when the silicone ended up getting out, we saw reactions to the silicone, gel, so to speak. So they started to change them to have a silicone bag with a fluid, a saline fluid in it. And theoretically, the concept was when the bag broke, because they can break, and they usually, or I'm not going to say usually, but do frequently, you're just leaking saline fluid and not necessarily silicone gel. And they thought that the outside gel or the outside bag was inert, but it's not necessarily inert. Your body sees it as a foreign substance. And what it does is it starts to wall off that area or starts to have issues with that foreign substance in your body.
Now, I've actually covered breast augmentation surgery videos, and have touched the actual bag that is implanted. And, it's soft, it's pliable, it feels good. I've asked a number of women why they did it. And of the 10 or 12 women I think that I talked to, not one had breast cancer and wanted to be rebuilt. And I understand that. I think that's an important issue. But the women that I spoke to were all having it done for cosmetic reasons.
Well, yeah, and obviously it's a cosmetic issue, and You know, I haven't looked it up, but I'd be curious to see the rates that it's performed in the United States versus other portions of the world. And I would anticipate that maybe we might have it a little bit more, but I might be mistaken. But, you know, there are quite a few risks when you're dealing with putting a foreign substance in your body. And it's kind of hard because how do you test and see if you're going to have a problem right ahead of time? It's not one of those things that you can do.
What happens, my understanding though, is that some women react and others don't. I don't know what the percentage is.
If you look at research, there was a research program done at the University of Alberta, and they concluded that about 25% of women with breast augmentation have an increase in autoimmune issues. We're seeing estrogens, we're seeing sarcoidosis, we're seeing systemic sclerosis, and it's an autoimmune problem, meaning that your body is having issues with the silicone, so to speak. And, you know, is there direct cause and effect when you're looking at this research? Well, no. I mean, how do you really know for sure? But I do think that we're seeing that it is just part of the puzzle, right? There's a piece of the program that this is just part of, and it's your body's way of creating a low-grade inflammatory response. In fact, you're seeing more problems with the textured bag. You probably held a smooth bag, right?
I did. I held a smooth bag. That's
Well,
exactly right.
they were using textured bags because they, so to speak, I guess they work better, but they're saying that some of the texture can harbor bacteria and therefore it can set up a low-grade infection. Now, I don't know if that's true or not, but they're seeing more problems with textured bags. And in different countries, they're saying that, you know, not to use textured bags.
I know that travel surgery, especially for cosmetic surgery, is very popular. People are going to South Africa, they're going to Asia. I can't think of anything else off the top of my head where the Caribbean, I believe, where people are actually going for cosmetic surgery in other countries because it's less expensive.
Yeah, I think I'd be careful no matter where you go. And, you know, there's certain things you don't want to cheap out on. And I'm thinking surgery is probably one of them, right? I mean,
Right.
you have to look at the risk versus reward. And, you know, I guess everybody's different and I'm not in that boat, but I would want to be very, very careful. You know, even our own FDA says that 20% of these bags rupture or deflate or cause scarring around the implant, or even, you know, multiple different symptomology, but they don't even warn about autoimmunity, which the new research is showing that is a very good possibility.
Wow. And the idea that it's just cosmetic has always been, I don't know, it bothers me. As I said at the beginning of our time, I understand if a woman wants to enhance her look. There's a big psychological aspect to this. Women having smaller breasts and wanting larger breasts, maybe even being suggested by a boyfriend or a spouse. The women that I spoke to, not one of them even talked to their spouse until they decided to do it, or boyfriend. They just felt that they were not endowed well enough. And the psychological aspect afterward was they had more self-confidence, more self-esteem. So that's a different tactic, and that's a reason for doing it. But to get that self-esteem in looking at yourself in the mirror, if you develop an autoimmune disease that's causing issues, that is something that women need to think about.
Well, and I think it's important because, yeah, the aesthetic portion of it, I completely understand. And, you know, I could see how it would help somebody's self-confidence and other things as well. But you really have to weigh the risks. And, you know, even the University of Texas looked at silicone implants and they found an increase in autoimmunity. The World Health Organization and the FDA also have found a slight increase in anaplastic large cell lymphomas, which is a cancer. And they found it around the scar tissue near the implant. And I want to show you here a picture of a procedure on a breast implant removal. Here, let's see if we can share this again.
They were removing the implant?
They're removing the implant, and what they're basically saying is that if you do have an implant removal, can you see the screen?
Yes.
Okay. You want to make sure that you have an en bloc procedure. And that's kind of not necessarily spelled right. It's EN space BLOC. And you want to remove the entire capsule because your body forms a capsule around that breast implant. And is that the area that we're seeing anaplastic large cell lymphoma? I don't know, but I know that this procedure is making a difference for a lot of people's health. You hear so many women out there complain about so many symptoms, and they go ahead and they have the breast augmentation removed, and they're noticing quite a bit of a difference in their health. In fact, there was a Dutch research study that showed that out of 52 women that had breast augmentation removal, 69% said they felt better afterwards. And that's not a big research study, and I'm sure, who knows how well it was done. But it's something to be considering about your health. Are you having those issues, and what kind of chronic problems are you having?
Well, what happens, Dr. Celaya, when a woman has them removed? I mean, she goes from a one size to a smaller size.
I think at that point, you really, it's your health or your aesthetics. I don't know. And I'm not saying for women to do it either way. I don't know. What I do know is that some women reported that they do have an improvement in their health. And I don't think it's the entire piece of the puzzle. I think there's a lot more involved to it. This is just one little piece of the puzzle to feeling better and reducing autoimmunity and other types of diseases. But you've really got to be very concerned and think about what you're doing before you do it, especially when you enter into something that's a foreign system or into your body. It's like, for example, if I have somebody that's going in for dental work or even orthopedic work, there's a special test I'll run to take a look at the different either chemicals and or substances that they're going to be using in that person's body, and be able to evaluate how your immune system is going to respond to those things ahead of time before they have the surgery.
So if a woman decides, I do want to have a breast implant, you can do a test to see if she's going to have a reaction to the silicone?
Well, I don't know if that test is out there. I haven't done the homework on that. I have on orthopedic supplies and or breast augmentation. If you think about it, usually when somebody goes in for, let's say, a hip replacement, it can be a couple different ideas. One, first off, they have a trauma and they had a fracture and they have no choice. They have to go in immediately and get it done. And you don't really have much of a choice. The other way is the hip is just worn out and now you need surgery. Well, what people do is they choose their doctor first, and the doctor is educated in a certain brand of hip replacement or joint replacement, because when they purchase the joint replacement from the company, and I'm not going to use a bunch of names,
sure,
but the company produces a whole jig setup that the doctor uses to fit the hip or the implant. And
it's like being in somebody's workshop.
Yeah, it's pretty amazing. I mean, they're beautiful sets. And the manufacturer usually uses a certain type of metal, right? Like either chrome or titanium or whatever. So people choose their doctor, and then the doctor chooses the implant type. What they should do is look and see what type of problems they may have if they have an immune response to any one of the different metals or plastics or any other substances that are used in the surgery, and work backwards and find the doctors that use the opposite type of implant that you don't have a response to. And so I haven't seen that yet for breast augmentation, but we're seeing issues from breast augmentation. So just my concern is that you have to be very careful. I completely understand the reason why they're getting them, but you have to look at long-term health effects. And This is just one little piece of the puzzle that's adding up to health problems.
Got it. Let's go over very quickly as we wrap up today some of the symptoms that women are experiencing after having breast augmentation. And I forgot to ask, does this happen relatively soon?
Well, it's hard to say. It could happen at any given point in time. And, you know, we've talked about it. There's the local symptomology, the pain, discomforts, the contractions, the rashes, you know, different body odors, different, anything autoimmune. And we've talked about autoimmune. You could have any symptom imaginable. In fact, before this, I was watching a video of a young gal who had breast augmentation surgery, and she was just in so much pain and discomfort. And this, I don't remember how long it was after the surgery, but she looked like a train wreck. She then went and had them removed, and she felt much better. And you look at the before and after pictures, and they look way different. Yeah, I can't say, you know, I didn't see her. This was just on a video.
Sure.
But for her, she said it made a huge difference in her life. And it's, you know, there's plenty of videos out there. But it's hard to say because it hasn't been researched. I mean, who's going to pay for the research on that, right?
Not the people who are supplying the little bags of saline, right?
No, there's a large part of the economy that's driven. Well, I wouldn't say large, but a percentage of the economy that's driven towards aesthetic surgery, right? And so they're not going to necessarily go ahead and start to do research to disprove the benefits.
Do you have any other thoughts on breast augmentation for us?
No, you just have to be careful. Whatever you do with your body, there is no free lunch. And we talk about that all the time. It's
Right.
something you have to be careful of. And we have so many different pieces of the puzzle causing problems with our health today. You just don't want to have to go down and add another piece on purpose, right? And like I keep saying, I understand the reasons why, but you really have to weigh the cause and effect.
So the bottom line is that if you're considering breast augmentation, or if you've had breast augmentation, you might consider having some testing done to see if you're having what you're having, and if you have developed an autoimmune disease or disorder. Would that be accurate?
Yeah, you can test for autoimmunity. You also look at ultrasound of that surrounding area. You can also look at T cell counts. There's many different things that you can do, but there's not one thing that says this is exactly why, right? It's not that way at this point, and we need a lot more research. But like I said, I don't know if we're going to see it.
Got it. Dr. Celaya, thanks for joining us here on Late Night Health. If you want information on Dr. Celaya, visit him at drcelaya.com, drcelaya.com. Take a look around. Lots of videos, lots of information, and most importantly, there is a link where you can actually schedule an appointment for 15 minutes of free information one-on-one with Dr. Celaya. So be sure to visit him at drcelaya.com. And if you want more information on health, you can always visit us at latenighthealth.com, latenighthealth.com. For Dr. Celaya, I'm Mark Alyn. We'll see you next time.